Good afternoon, everyone. Welcome to this week's episode of Did You Know? This week on Did You Know, we're going to talk about CCI and NCCI edits. We're going to cover quite a bit of information as we look at this. We're going to talk about what CCI and NCCI are. We're going to talk about where you can find information on the NCCI edits and cover a number of areas of information around NCCI edits. How often they're updated, what the different types are. There's P2P and MUE and add-on and all these different varieties. And then we're going to talk about when NCCI applies, who's supposed to use it, and where you can find these specific edits. So let's go ahead and dive right in and get started. We're going to start out by answering that first question. What is CCI or NCCI? NCCI stands for the National Correct Coding Initiative, and sometimes we refer to it just as CCI or the Correct Coding Initiative. This is where CMS has developed certain edits. They have said, okay, there are certain services, certain CPT codes that are bundled into other CPT codes. Now, usually when we think about bundling and we think about when one code is included in another, we start thinking about things like the guidelines in our CPT manual. Absolutely, those bundle things for us. But in addition to that, CMS has additional edits that they've built that may or may not be referenced in CPT. And in building these things and identifying which codes should be bundled together as part of one unique service, they've looked at things like the coding conventions that are in CPT, but they've also looked at both their national and their local coverage policies and any edits that the local carriers may have established. And when I talk about local carriers, I'm talking predominantly about your Medicare administrative contractors, right? Your MACs. These coding guidelines also include anything that's been developed by the national societies. Things like the American Psychiatric Association or the American Association of Orthopedic Surgeons. They put out their own guidelines and policies as to what they feel is included in a service. And oftentimes those are things that CMS has looked at in determining, okay, is this part of this one CPT code or can they bill it separately? They've also conducted an analysis of standard medical and surgical practices. So they've looked to see what is consistently done. And if it's something that has to be performed, for example, if you're going to perform an endoscopy on a patient, maybe they're going to do an esophageal endoscopy. Oftentimes there's got to be an intubation that's done, right? Some sort of intubation. So that may be bundled as we start to look at these services. Those are the types of things we're looking at. And obviously they review current coding practices to see should this be a separately allowable service. Now, when we look at CCI and NCCI, I've given you a nifty little hyperlink right here on the top of the slide. That's going to take you directly to the CMS website. I'm actually going to go ahead and go over to that link right there at the top myself. If you don't have this link available to you, maybe you're thinking about this in a few weeks and you're like, oh, I know Chandra told me about that on that Did You Know episode. Well, I don't want to go back and look it up. I don't have that kind of time. How can I find it quickly? Go to Google and type in NCCI edits. It's going to pop up the same link as one of your first choices. So let's go ahead and go over to that CMS link. Okay, when you click on that link, this is where it's going to take you. Notice I'm on the cms.gov website. I'm under Medicare, and there's actually a page devoted to nothing but the National Correct Coding Initiative and those related edits. If you were to read through this page, you would find out right here in this first paragraph is where I gathered much of the information we had on that slide, where we talked about CMS developed these edits. The reason they developed these edits, it's right here. They want to promote correct coding methodologies and control improper coding that leads to inappropriate payments. This all started particularly for Part B claims. Well, that makes sense because that's where we use CPT. And as we look through here, you'll see these actually began clear back January 1st of 1996. That's when we started with some of the National Correct Coding initiatives being implemented for Medicare and being effective for CMS and Medicare. They've gone on to add other code sets like the MUE edits, things like that. And we're going to talk about what all of these acronyms mean. But the important piece that I want to point out here is that this was expanded and covers not just Part B services when we talk and we think about physicians. And I know that's what a lot of you on the professional side are thinking right now, right? I use NCCI edits because I'm coding for my physician. But it actually also affects the outpatient code editor, or the OCE, for those outpatient facilities, including your therapy providers, your skilled nursing facilities, your comprehensive outpatient rehabilitation facilities, your home health agencies. All of those are included in this. So you could use these edits in a number of different places. And they have since expanded the tables that we're going to look at. And there's separate tables for professional services than there are for facility services. So they've really expanded this code set. So what is NCCI all about? Well, NCCI is, as I said, right, they're making sure that certain services aren't bundled. And the way they do that, if you come down a little bit farther on the page here, you'll see they talk right here about procedure to procedure edits. Those procedure to procedure edits are what we're talking about when we say CMS is determining whether or not one service is bundled into another service. They're telling you how one procedure relates to another. So that's why they call them P2P, or procedure to procedure edits. And this is set up in a table format, so you can check one code against one other code at any particular time. And it has two columns of codes, just as we'd expect, right? Your column 1 and your column 2, because I'm checking two different codes against each other. When you look at these, there is a manual that goes along with these edits. Many people know about NCCI edits, okay? Especially if you're working on the billing side of things. People will oftentimes say, well, I got a denial for these two services when I reported them together, and the denial said one service was included in the other service. But I don't think it should be. Well, we'll usually tell you, if you talk to anybody else that's experienced, we'll say, well, did you go check the NCCI edits? Is there a check tool that alerts you that those can't be reported together? So most people are familiar with using the editing system, but what they fail to realize is there's an entire policy manual that goes along with those edits. So we're going to take a look at that policy manual as well, because that'll answer a lot of your questions if you're just getting into the coding and billing side of things. And the NCCI edits, remember, these come into play from a billing perspective. These will not be something that you're tested for the CPC exam, if you're testing for AAPC. That CPC exam tests you strictly on the coding requirements. So it will test you on whether or not the guideline is in the CPT manual. If they've gone a step further and set it up as an NCCI edit, okay, maybe they say CPT says you can bill them separately, but CMS has come out and said, oh, no, that service is included in this other service. Those are going to be things they would test you on things like the CPB, or the Certified Professional Billing Certification. So we'll talk through those. I'm going to go back to my slides for just a minute. So we've identified what NCCI is, right? It's that National Correct Coding Initiative. It's there to help control improper coding that leads to improper payments. In addition to that, we need to answer a couple other questions. So we've identified that there are edits, and that there are different types of edits. The first question that I normally get is, okay, you're going to explain this to me. You've already told me NCCI, right, are these edits, and that there are two codes being checked against each other. Well, and that they're all about controlling improper payment. Correct. You should also know they update these on a quarterly basis. So if you're maintaining your own spreadsheet system, you want to make sure that you're going out and downloading these edits on a quarterly basis, because they post new files every quarter. There are three predominant types of NCCI edits. By and large, the biggest one are those P2P edits, right? Those procedure to procedure edits. The ones where I said we're looking at one CPT code and seeing if it is included in this other CPT code. Now, when I say CPT code, that's probably a bit of a misnomer. It could be CPT code or HCPCS codes, because remember, CPT codes are one type of HCPCS code, or those HCPCS codes. So it could be either one of them. Okay, we're going to look at those procedure to procedure codes. And when we go and look at those, I'm going back to the same page I was on. But if I go to the top of this page, right? Over here on the left-hand side, there is a link that says P2P coding edits. And I can find out more information just about the procedure to procedure edits that are set up. And this is where they explain, okay, these procedures are either assigned to a column 1 or a column 2 file or the mutually exclusive list based on the criteria for each of the edits. Mutually exclusive identifies 2 procedures that could not be performed at the same patient encounter because those 2 procedures were mutually exclusive based on either anatomic, temporal, or gender considerations. What they're telling you there is if you have a mutually exclusive edit, it means that you could not possibly physically have done both procedures at the same time. You either did one or you did the other. They are mutually exclusive. They can never be performed together. Okay. In addition to those mutually exclusive edits, there are a number of other types of edits. Now you're probably going, okay, edits, edits, edits. What do all of these edit things look like? Well, what I'm going to encourage you to do is if you scroll, okay, I'm on the P2P coding edits page, right? Because I went to that link for NCCI and then I clicked over on the left-hand side to P2P coding edits. If we scroll down to the bottom, this is where you're going to find the actual tables full of edits. And you'll notice that the 2 for practitioner are purple on my screen. Those are the ones I'm going to show you examples of. The hospital ones are there if you work on the hospital facility things, right? Your skilled nursing facilities, your home health agencies, your outpatient physical therapy offices, things like that. Those are where those facilities are going to come into play. But I downloaded the practitioner ones because those are the ones that I'm most familiar with and those are the ones that I find used most frequently. When you download these 2 files, there are 2 of them. Make sure you get both of them. You'll notice this first one goes through 39599, and the next one then starts with 40490. So they're just so large, they didn't put them both in the same thing. Download them separately, and they're going to come up in an Excel file. Let me show you what they're going to look like. They're going to pull up in a file that looks about like this. What I did is I just merged both of them together. So this is file 1. You'll notice it ends in an F1 at the end of the file name. And I just put file 2 as a separate tab in the same workbook. So I could click between the 2. But these are set up so that we have 2 different columns, right? Column 1 and column 2. Then column D over here gives you the effective date. How long has that edit been around? And has that edit been deleted? Because there is a deletion date if they deleted that edit. Because sometimes they change a code descriptor and it may no longer be a bundled service or may no longer be part of that. So over here, you'll have a deletion date. If there is a star, that means it's still active. There's no deletion date as of yet. It's still a valid edit. Then you come to the tricky row, as I call it. Okay, column F. Okay, column F is where you're going to have a number. You're either going to have a 0, a 1, or a 9. 0 says you cannot put a modifier on these 2 codes. Basically, a 0 tells you these things cannot be reported together, typically because there is a CPT manual instruction saying you cannot report these 2 services at the same time. You can't do it. Okay. If you have a 1, that says that a modifier is allowed. However, you better review the documentation and you better look at the NCCI policy manual to make sure that they are truly separate services. As you look down through here, you'll see sometimes that 1 says these are mutually exclusive procedures. Typically, you did one or the other. Or it may be that it's a standard of medical and surgical practice. It's customary that you usually perform both services together. And if that is the case, these edits give you an idea as to which one is going to be paid. And I'll show you what I mean here in just a minute. You may also have a 9. And let me give you an example of one that has a 9. And I'm going to do it the easy way. I'm going to do a search, which is a Control F. And find the 9. Oh, let me expand my search. Let's do an edit, find, and I want to find entire cells only that have a 9 in them. Okay. And here's an example. Okay, this says there's 2 services here. The edit has since been deleted, unfortunately, but it says that there's no modifier needed. If you see a 9 and it says not applicable, what that's telling you is that it doesn't matter. You don't need a modifier. The 2 things are not going to be bundled together. It's not a mutually exclusive edit. It's not one where it's standard surgical practice. Typically just means they're separately reportable. Go ahead and report them. You can get paid legitimately for both services. Okay, so this is kind of the rationale behind all of these different edits. And there's, like I said, a couple of different pages of edits. We're going to come back and go have another go at these edits here in just a few minutes, but I wanted you to get an idea of what the table looked like. Now, when we were looking at this table initially, I told you, okay, if it has a 1, right, and a 1 says that you can have a modifier, it will allow a modifier, you better go out here and look and make sure what the policy manual says. Well, you're probably going, well, where do I find the policy manual? Oh, I'm going to show you. Back on the same page, right, we're still on my P2P coding edits, but I'm going to go back to just the NCCI page. So all I do is click this link right here before it says National Correct Coding Initiative Edits, and I'm going to scroll to the bottom. And down here, they give you lots of really useful tools. This first one says how to use the NCCI edit tools. Well, I'm kind of showing you how to do that, but I already have that popped open in a tab. There is a PDF file by the Medicare Learning Network from CMS that shows you just how to use this. How do I look it up? What do those different indicators mean, right? That 0, 1, and 9. How do I properly submit my claims? As you scroll through this document, you're going to find that they answer many of the questions that you have, right? They go through all of the same sorts of things that I'm going through, but they also give you a lot of background on the NCCI edits, where they came from, why they're used, all of that, beyond just the fact that they're there to help, ensure proper payment for services rendered. Okay, so they answer all of these different questions for you. In addition to that how-to manual, if you go down towards the bottom, they include Chapter 23. It says Fee Schedule Administration and Coding Requirements. That is Chapter 23 of the Claims Processing Manual, which is one of our internet-only manuals. If you were to open that, which I've actually already clicked on it and have it open in another tab, this goes through how to report your rules, okay? And this is your general rules for claim submission. And it does split it into general rules for diagnosis coding. What do you do on an inpatient claim versus an outpatient claim? What about those ICD procedure codes, which are now our ICD-10 PCS codes? Used to be ICD-9 Volume 3, right? They go through all of the different areas for you and explain some of the same things. In addition to that, they give you a really nice article on the usage of modifier 59. Now, when we talk about NCCI edits, the reason that I wanted to bring this up is because oftentimes people will receive a denial, and it'll say something like, well, this procedure is bundled into this procedure. And they will go look at the NCCI edits and see that a modifier is allowed, and without even looking at the documentation, they'll slap a 59 on there. And the reason they put a 59 on there is they know it's going to unbundle the service, right? If I said, here's procedure A and it includes procedure B, and you put a 59 on there, what's going to happen? Well, you just told me that A and B are totally separate. They're distinct procedural services. Well, you need to make sure that you're looking at the documentation before you go that far, right? Because we want to make sure that they truly are distinct procedural services. But in addition to those documents, they give you the NCCI policy manual for Medicare services. So this is the manual that goes along with those edits and tells you what to do. Now, you'll notice this is a zip file. All these other ones have that little PDF document at the end of them. This one is a zip file. So I'm going to take you to a different screen. My screen's going to be a lot smaller. It's one that won't let me enlarge, but it'll give you an idea what it looks like when you download that file. So let's go over and take a look at what it looks like. Okay. This is where I have, let me enlarge my screen as much as it'll let me. Okay, down here at the bottom, these are all of the files that are included in that zip file. Up here at the top, it's just giving me a preview of what it looks like. Don't worry, I'm going to open these are all PDF files. I'm going to open a few and give you an idea of what it looks like. Well, the first thing that I'm going to open is the table of contents. Okay, so let's open the table of contents, see what that PDF file looks like. See if I can fix this up here. Continuous scroll. There we go. We can make it really nice and big for you. As we scroll through here in the table of contents, you're going to see it tells you right up here at the beginning. They'll give you an introduction, the purpose, the background behind it, sources of information, a list of acronyms. That's huge, right? We're always trying to figure out what Medicare is calling all of these different abbreviations like NCCI, MUE, CMS, ENM. We've got all of these different acronyms that we need to be familiar with. They also go on to further define the surgical package. It's very important that you understand that, because I know in CMS, or I'm sorry, in CPT, right, in our CPT book, there's a definition of the surgical package from a CPT perspective. And it tells you things like an evaluation and management service, you know, the day of or the day before the service is performed if it's subsequent to the decision for surgery. It tells you things like the post-op information, all of the writing orders and documenting the services. This definition actually goes much further than that. So let's actually go down to page I-12. Okay, we'll do a little search here. And we're going to go down here to, where am I at? Oh, I actually have to go to that section. Sorry about that. I wasn't thinking. Okay, so I want to go find this page. This is in Chapter 1, the correct coding policies. So I'm going to close this PDF file. I'm going to go back to my menu bar, right? And you'll see I have Chapter 1, which is where it told me that one was, Chapter 2, and the Chapter 2 down to Chapter 13 give you the code ranges associated. So these would be anything that starts with a 0, so your anesthesia services. Anything that starts with a 1, your integumentary system. Anything that starts with a 2, the musculoskeletal, so forth and so on, all the way through here. And then down the very bottom, you get into those HCPCS codes and even those Category 2 codes. So let's take a look at the general coding guidelines, because it told me I wanted to look at those for this definition of the surgical package. Let me blow this up for you again. Okay. Okay. So I'm in Chapter 1 and I want to go down and look for, I want my continuous scroll to keep going. That's what I want. There we go. So we're going to go down and look for that definition of a surgical package, which it tells me right here is on page I-12. So I'm going to look for 12. Okay. We're going to go right down here. Nope. I-12. There we go. So if we come right back up here, this is page I-12. It says here's the medical surgical package. And this goes on to say, hey, guess what? Most medical and surgical procedures include pre-procedure, intra-procedure, and post-procedural work, which we already knew. But it comes on down here to tell you that many invasive procedures require vascular or airway access. So that's going to be bundled. For example, airway access is necessary for any type of general anesthesia and is not separately reportable. There's no CPT code for elective endotracheal intubation. CPT code 31500 describes an emergency endotracheal intubation and should not be reported for elective endotracheal intubation. When they use the word elective, that doesn't mean that you went in and said, hey, I want to be intubated. It means that you had a non-emergency procedure. So you had some sort of scheduled procedure and we had to intubate you in order to do that procedure. That's all they're talking about with the word elective. So don't let that throw you off and make it you think it's a cosmetic procedure or anything strange like that. These are your usual services that your providers are performing. They're just not emergency services. You know, an emergency situation would be something like a patient that came in with trauma and their airway collapsed, or a patient who came in with an appendectomy, right? That we had to get them out right this very minute. It's an emergency procedure. Those are the situations where we may have to do an emergency endotracheal intubation. But these elective endotracheal intubations means maybe they came in and we're doing bariatric surgery. We're going to put them out. In order for them to be anesthetized, we want general anesthetic, and we need to do an intubation to keep their airway going. Because if you don't know, under general anesthesia, you lose control of your airway. So you need somebody else to maintain that for you. Okay, so they tell you right here, okay, well, we're going to bundle airway access if it's needed for general anesthesia. We're going to bundle intravenous access if it's done with surgical procedures, anesthesia procedures, radiology procedures that require invasive contrast, nuclear medicine procedures, all of these types of things. So there's a whole lot more bundled here than what we consider bundled in CPT. So you've got to be familiar with these. And that's why I said, if you haven't had a chance to look at this policy manual or nobody's ever told you about it, this will answer a ton of your questions as they relate to any edits that you may be receiving from your billing system. And when I say that, most billing systems, when you enter your CPT codes, they do what we call a front-end claim scrubbing, right? And they have these edits built in a table somewhere in that billing system, and it runs them through there before it sends the claim on to the clearinghouse or the carrier. And it will, if it sees a problem, it says, oh, there's an NCCI edit, it's going to kick it back out to whoever the person is that works the edits. Oftentimes it's somebody who is doing the billing and the charge entry and the denial management for that particular provider. So they'll have to work those edits before it gets submitted to the insurance carrier. Once it gets submitted to the insurance carrier, if there's still a problem, you could get a denial back from the insurance carrier that may still be related to these NCCI edits. So you want to come out here and always check this policy manual first. And don't worry, we're going to go through an example here in a few minutes where I'll show you. Somebody asked me a question the other day about, well, why is my doctor putting a 59 on these two procedures when CPT doesn't say that they're bundled? And we'll go through that example here in a few minutes. So I'm going to go ahead and close out of here. I'm going to go back to my slideshow for just a minute so I make sure I stay on track. Okay, so we talked a little bit about these procedure to procedure edits, right? We said that's where Medicare is identifying one procedure is bundled inside another procedure. Well, what are these MUE things, right? These are our medically unlikely edits. These were implemented in January 1st of 2007. So any data service on or after January 1st of 2007, we started using MUE edits. Well, let's go take a look and see what MUE edits are all about. I'm back on the same page for CMS, right, my NCCI. But over here on the left, I'm going to click on the medically unlikely edits. And this is where a claim may be denied or data service may be denied based on the fact that it is medically unlikely for whatever is being reported to actually occur. I like to use kind of ridiculous examples that I've actually seen in a billing system, right? And a good example of that would be something like billing 3 units of a cholecystectomy. Cholecystectomy is removal of the gallbladder. If you're billing that you removed 3 gallbladders from the same patient, that is medically unlikely, right? It's highly unlikely that they have 3 gallbladders. So those are the types of things that are considered medically unlikely edits, and they're going to kick out. So they do update these, again, on a quarterly basis, just like they do the P2P edits. And you want to make sure that you're familiar with these as well. Okay, there's a whole page all about medically unlikely edits. And there's a bunch of information on them in the NCCI edit FAQs, which we'll look at here in a few minutes. And there, again, are practitioner tables just for medically unlikely edits. And you'll see that there are 2 for this year because we have whatever came out January 1st, and then we updated it again April 1st. So you want to make sure that you're looking at the most current one so that you've got all of the information that you need for this quarter. So those are your medically unlikely edits. The next type of edit that we have is what we call our add-on code edits. Well, you're probably going, why do we even have edits for add-on codes? If you know what an add-on code is, right? An add-on code are those in the CPT manual that have the plus symbol in front of them. And it means they can't be billed by themselves, right? They have to be billed in addition to another procedure. Well, CMS actually explains a few things. They put these add-on code edits in place April 1st, 2013. So they haven't been around as long as the other edits, right? When we think about NCCI and P2P edits being around since 1996, right? This is considerably longer period. But when we look at these add-on code edits, they say, okay, an add-on code is a HCPCS or CPT code that describes a service that is always performed in conjunction with another primary service. There are things that they call an add-on code with one exception. And that says that those add-on codes with one exception means that it is a code that is eligible for payment only if it is reported with an appropriate procedure performed by the same practitioner. And if it is an add-on code with one exception, it's never eligible for payment if it's the only procedure reported by a practitioner. Well, those are the things that we would expect to see, right? We can't report add-on codes by themselves. They have to be billed in addition to something else. So in order to ensure that they were actually checking for this, Medicare created add-on code edits to ensure that add-on codes were only being appropriately paid when they were billed with their primary or base procedure. So if you go out to the NCCI initiatives link that I gave you, right? And then we're going to click on add-on codes over on the left-hand menu bar. It'll go through here and give you an idea of the different types of add-on codes. And they say right down here that add-on codes are identified one of three ways. The code is either listed in the CR or subsequent ones as a type 1, type 2, or type 3 add-on code, or you can find them by looking in the physician fee schedule database, which we talked about in a previous episode of Did You Know here at CCO. Okay, and that generally the add-on code has a global surgical period of ZZZ, and that ZZZ said it takes on the global period of the primary code that it's billed in addition to. Okay, or in the CPT manual, those add-on codes have that plus symbol, which means you have to bill it with something else. So you can find it one of three ways. Then they come down here and they distinguish them for payment. They say a type 1. Okay, so a type 1 add-on code has a limited number of identifiable primary procedure codes. It only has certain things that it can be billed with. And those are the only primary procedure codes it can be associated with in order to get paid. A type 2 says it doesn't really have a specific list of primary procedure codes. And those add-on codes it lists the type 2 add-on codes, but it doesn't list any primary procedure code for them because you can kind of bill it with lots of different things. But they want you to make sure, they encourage their contractors, so their Medicare administrative contractors, what used to know their fiscal intermediaries, right, to develop their own list of procedure codes that they expect them to be reported with. And then the type 3 add-on codes have some, but not all, specific primary procedure codes identified in the CPT manual. And this would be things that type 3 add-on codes with the primary procedure codes that are specifically identifiable. So these are things that there is not an exclusive list of procedures that they could be reported with. They could be reported with almost anything as far as primaries go. These are a very limited code set, and this again is where the contractors typically put together a list. Now, for both the type 2 and the type 3, when I'm talking about contractors putting together a list, talking about your LCDs, right? Your local coverage determinations. That's usually where you're going to find information on these local edits that are established by the Medicare administrative contractors. So you want to make sure that you're familiar with those and how they're processing your different add-on codes to ensure proper payment for your physicians. All right, so we have talked through, we talked through what NCCI is, right? And why we have it. We've talked through the P2P edits, the MUE edits, the add-on code edits. So now you're probably ready to ask a few more questions. Well, before we go too far into, okay, how do we actually use this? How do we use this code pair checking? And do I have to pay for code pair checking software? Does it only apply to Medicare claims? All of that. Let's back up for just a second and remember a few things. CMS developed NCCI, okay? So it's all about Medicare. That's who it was developed for. Does that mean that it is exclusive to Medicare? No. As they say on that primary National Correct Coding Initiative page on the CMS website, carriers began implementing the procedure-to-procedure, or the P2P edits, January 1st of 1996 or after. And they started with the MUE edits January 1st of 2007. They started with the add-on code edits January 1st, 2013. They say carrier. When they say carrier, they're talking about their Medicare administrative contractors, but by and large, Medicare is not the only one that uses these NCCI edits. Most all commercial carriers have some form of NCCI edit that they also follow. They typically follow the national ones, and they may or may not follow the local edits developed by the different regional Medicare administrative contractors. They may also have their own quote-unquote local edits that they include for certain services, like those add-on services. So no, you should not just be checking NCCI for Medicare. You should be checking NCCI for all of your carriers, because more often than not, most of the carriers follow the National Correct Coding Initiative edits. That's why they're called national. Okay, not just for national Medicare, but many of the commercial carriers have followed suit as well when they talk about bundling. So let's get into these last three questions that we have on our agenda here. What is code pair checking? Well, code pair checking is what most of us call going and looking to see if two codes can be billed together, right? It's just kind of the slang that we use. Did you use a code pair checker? Did you check to see if the two services can be reported together? There is specific code pair checking software. Now, I know I showed you that CMS spreadsheet of all of the edits. They're all there. You can use that spreadsheet. It's just most people do not find that easy to follow. They would rather have a code pair checker that tells them a little more explicitly what to do with the service. Do you have to pay for code pair checking software? You don't have to pay for it because you can use the Excel spreadsheet. But if you want a code pair checking software, yes, you will probably have to pay for it. And it's usually included in many of your encoding services. I know things like Find a Code include it. The AAPC Coder, that software that they offer. Your 3M encoder. Most of those types of packages include a code pair checker. So we'll take a look at a code pair checker, and I'll show you the difference between that and that Excel spreadsheet. Does code pair checking only apply to Medicare? We've already talked about this. No. Many other commercial carriers tend to follow those same NCCI edits. So you want to make sure that you're checking that and looking at their policy manuals as well. So let's talk about a couple of examples here. And let me show you what the code pair checking software looks like. So I received a message the other day from a student who asked me, okay, I work in a clinic and I'm just starting to learn the billing side of things, and I have a physician who is billing two codes together. And he's reporting a 59 modifier on one of the two codes, and I can't quite figure out why, because there's nothing in the CPT manual that tells me he needs a modifier. Okay. The two procedures that he is reporting together are 64450 and 77002. Well, 64450 is a type of nerve block, in case you're curious. It's a peripheral nerve block. I will have to look to tell you exactly where that nerve block is being performed. And 77002, I believe, is the guidance, the imaging guidance used in doing the nerve block. Well, as a matter of fact, if we were to look this up in CPT, I'm going to pull out my CPT manual real quick so that I can give you a little bit more definitive description here. So if I look up 64450 in my CPT manual, what I find is 64450 says I have an injection of an anesthetic agent, and I am inserting it to an other peripheral nerve or branch. There is nothing underneath there to tell me that I cannot report it with some other service. There is no instruction at the beginning that says that I cannot report it with imaging. So I'm going to go look up that imaging code to make sure that there's no guidance back there that says I can't bill the two together. 77002, if you look up 77002, it says fluoroscopic guidance for needle placement, for example, biopsy, aspiration, injection, or localization device. See appropriate surgical code for the procedure and the anatomic location. And it is included in all arthrographic radiological supervision and interpretation codes. And don't report it with certain services. However, my 64450 is not in that list of things that it can't be reported with. So in my mind, I'm going, all right, according to CPT, they're separately reportable. The provider is using a 59 modifier. Well, I'm going to go look and see, maybe there's an NCCI edit, and that's why he's using that 59 modifier. So let's start out by using the table. I'm going to show you how this works. So I'm in the table, right? Down there in my edits table. I'm going to do a control find, and I'm going to look for my 64450. Okay. And I want my 64450 to, I want to look through here. It's listed a bunch of times. I'm looking for it in one column and my 77002 in the other column. This is why most people do not like looking through here. I'm actually going to do a search and see if it is in my column 1. So I'm going to do a find, and I'm going to get specific, and I'm going to say search by column instead of row, because I want it to search down that first one before it goes to the next one. And I want to find my 64450. Okay. It does not find it until that next column. So now I'm going to say, look for my 77002. But I want to find it here. Find. Okay. Now the problem is, if I remember correctly, this page, one of the things that I oftentimes fail to point out is the reason that a number of people do not use these Excel files and opt for a code pair checking tool is these Excel files are hundreds of thousands of line items long, which means that sometimes your computers just don't like to mess with them. And I am running a really new Mac, and it will not cooperate with me. It keeps locking up when I'm trying to find the codes that I'm looking for because they're so far in the sheet. The other thing that you have to remember is there's 2 sheets. So this first sheet only goes to the 40,000 series of codes when we talk about what's in those column 1s. When I get to sheet 2 and I do that same search, that's when my computer seems to be locking up. It doesn't want to do the search for me, and I'll give you an idea of what it does. It just gets stuck. It's like it splits the screen and it won't ever finish processing. So I'm going to go ahead and hit escape out of that and show you that what would happen and what I was looking for is the 64450 in one column with the 77002 in the next column to see what the modifier is for it. I will tell you that it does have an effective edit. It has not yet been deleted, and the modifier that displays for those 2 combinations together is a 1, saying it is allowed. And what many people, the reason they want to use a code pair checker is sometimes it's hard from this spreadsheet to tell whether or not they can report them separately. So let me show you what a code pair checking tool looks like. Let me go over to here, and I actually have, I'm going to use find a code. That's what we tend to use here at CCO. So I click on the NCCI edits validator. Okay, right down here. It's my 3rd box. I'm going to click on that. And this tells me right up front, hey, this is the non-facility version. If I want the facility version, I actually have to change which one I have selected. So I'm going to come over here, and I said my 2 codes were 64450, and I'm going to hit a return just because I like to see them separately, and a 77002. And you click this validate button, and that's what's going to check the 2 together. And it says, okay, it's calculating, and it says, uh-oh, you have a warning. The 64450 is fine to report, right? It's okay. You're great. Everything is going to go fine. However, that 7702, I'm sorry, 002, when you add it to this, says, oh, there's a warning. There is an edit between 64450 and 77002. 77002 is the column 2 code, meaning in that spreadsheet, 64450 shows up in the first column, 77002 shows up in the second column. Those second column codes are the ones that are usually going to be bundled into the primary code. So it says 77002 is a column 2 code. If you report both of them together, only the 64450 will be paid. However, a modifier can be used when appropriate. So we need to make sure that it is appropriate to report both of them. So the question I got when I said, okay, there's an edit, and it says we might be able to use a modifier if the two are truly separately allowable. And the person said, well, how do I figure that out? Great question. This is where that NCCI policy manual comes into play. So if we go back over to the policy manual, there's so much into this. Did you ever have any idea there was going to be this much? I'm going to go into the CPT codes in the 60,000 series because I'm looking for that 64450 first. Let me continue a scroll. Let me make it big for you. I don't know why it switches out of that every time. Okay, and I'm going to put in, I want to find 64450. Okay. And there are no specific codes for 64450, but it takes me to the code range that 64450 would be included in, right? And it says CPT codes 64400 through 64530 describe an injection of an anesthetic agent for diagnostic or therapeutic services. The codes being distinguished from one another by the name of the nerve and whether a single or continuous infusion catheter is used. All injections into the nerve, including branches described by the code descriptor, constitute a single unit of service. Okay. I'm looking all for what I want to know is, can I bill my fluoroscopic guidance with it? Okay. And as I keep looking, let's see where else they have 644. Okay. I'm going to go a little farther down. That's the paragraph we already read. Okay. Wow, those are the only two that we have for that. So there's nothing here that says, let me make sure. Okay, well, if it's used for an anesthetic procedure, we cannot unbundle it from anesthesia. Well, we're not using it as an anesthetic. We're doing a nerve block. That is the procedure we're performing. And in that case, okay, it's not an anesthetic. If we're doing it for moderate sedation, we're not doing it for moderate sedation. Scroll down a little bit farther and see if there's anywhere else that uses that code. Let's see. These codes describe services that may be utilized for post-operative pain management. The services described by these codes may be reported by the physician performing the operative procedure only if provided for purposes unrelated to post-op pain. Well, there was nothing in the documentation that we looked at when the person asked me, there wasn't anything saying it was for post-op pain management. This was just a pain management procedure in a physician's office, and that was the only thing they were doing. It wasn't post-op. It wasn't anything like that. Okay. Let's see if there's anything else. That's our post-op pain management. And that's it. Then it takes me back to the top. So the next thing I would do is, all right, I've looked at the the injection code. Now I'm going to go double check and make sure there isn't anything around the fluoroscopic guidance that tells me I can't report it. So that's in my 70,000. I'm going to go into chapter 9 and open it. Let me get this. View, continue to scroll. Make it big enough we can see it. And I'm going to look for the 77002. And what I find is the very first one, there's 2 page items, and it says the 77002 is part of a group of codes that describe radiological guidance. CMS allows for 1 unit of service for any of these codes at any single patient encounter, regardless of the number of placements performed. So it doesn't matter how many times they do it, they only get a bill at one time. The units of service for these codes is the patient encounter, not the number of lesions, aspirations, biopsies, injections, or localizations. Okay, so we only get one unit. We understand that. Let's see what the other says. Says radiological supervision and interpretation codes include all radiological services necessary to complete the service. CPT codes for fluoroscopy, fluoroscopic guidance, or ultrasound and ultrasound guidance should not be reported separately from the radiological supervision and interpretation. That's what they're talking about. It's, when you do this code, you're doing all of that. You're doing the localization and the reporting for it. Radiological guidance procedures include all radiological services necessary to complete the procedure. CPT codes for fluoroscopy should not be reported separately with fluoroscopic guidance procedure. CPT codes for ultrasound should not be reported separately with an ultrasound guidance procedure. It's part of it, right? If you did fluoroscopic guidance, you have the fluoroscopies bundled. That's what they're saying there. Same thing for CT, can't be reported separately, all of that. If you were to read through the rest here, those are the only two matches for the 77002. I went a little bit farther and read even more into these different areas. And what I found was actually in the 60,000 series. Let me go back and pull that up. And what I found was that many of the codes in the same area as that branch code, right? That other peripheral nerve or branch anesthetic, the nerve block that they were doing. What I found is the reason that I believe that edit exists is if we were using some of the other codes in that area, like it says lumbar plexus, posterior approach, continuous infusion by catheter, all of that, there is actually an edit in here that says that if you are doing an injection into the spine or into the epidural space, that fluoroscopic guidance is not separately reportable according to Medicare. So my response to the student who asked me the question, why is my provider putting a 59 on there? If your provider is putting a 59 when 64450 and 77002 are put together, the documentation should clearly indicate that injection, because it says other peripheral nerve or branch, was not made into the spine or the epidural space. And that's what they're doing. They're saying, hey, this isn't a spinal procedure, so I should be able to report my fluoroscopy separately. And that's why I say you've really got to understand the manual that goes along with the NCCI edits, in addition to your typical CPT rules. Those are all of the things that we can glean from all of these pages. And there's a ton of information in this NCCI policy manual, and it's updated at least annually. Like I said, the edits are updated quarterly, and usually they go along and make the same edits here in the manual. But they only update the manual once a year, so you want to make sure you're going back in and checking that manual. So let's wrap up a little bit. We covered a lot of information in today's Did You Know session, right? We talked about CCI and NCCI, those National Correct Coding Initiative edits, and that the reason they exist is to ensure proper code assignment and to safeguard against improper payment, right, for not coding correctly, identifying what services are bundled together and when we can separate them and how we know to use certain modifiers. The more familiar that you are with CCI and NCCI, the fewer denials you're going to see right off the bat, the easier it's going to be to work your front-end edits when they go through that claim scrubbing software. Excuse me, but the other thing that's going to make it really easy is when you get a lot of denials, because you should be able to look at the NCCI manual and go, oh, for certain carriers, you're going to know why you got a denial. You're going to have hit an NCCI edit that you maybe didn't have loaded in your front-end editing system. So it'll become easier and easier to work, which means cleaner claims going out the door, fewer denials. So you're spending less time and money working your denials, and you're getting the correct payment and correct reporting right off the bat, which makes everybody happier, right? Makes our lives a lot easier. As we always say on Did You Know, these episodes are geared all around helping you learn things that you need to know to be able to do coding and coding related jobs well on a day in to day out basis. And as you're getting into coding and billing and just this entire industry, you want to make sure that you're demonstrating that you're a self-starter, and knowing that NCCI edits exist, knowing where the policy manual is, knowing how to use not only the code pair checking software, but also those Excel spreadsheets and what a column 1 is versus a column 2, really give you a leg up on the other individuals who may not know that information. You're going to be able to explain things to your provider and help save them money that they might not otherwise know. So you always want to be that self-starter. You always want to be the one that people can go to for information and to help them find what they're looking for, because then you become an invaluable resource for so many other reasons. Remember that you are your own best resource. You want to become more and more familiar with all the different tools that will help you do your job to the best of your ability. Hopefully this session here from CCO on NCCI edits has been beneficial for you. You've learned what NCCI edits are if you didn't already know. You know where to find more information on them. You know how to check column 1 and column 2 edits even if you don't have a code pair checking software. And you know where to find that policy manual, and you'll read up on that and start learning what services are bundled together. I would definitely encourage you, if you work in a specific specialty, at least go out and look at the part of the NCCI policy manual that applies to the services that you report. If you work in gastroenterology, go out there and pull up those 40,000 series codes and look and see what it says about bundling things together. I guarantee it will open your eyes and give you several aha moments as to why you're getting certain denials, or why you can't bill certain things together without modifiers, why your providers are using certain modifiers. Those are all great things to be familiar with. So again, hopefully this helped you out and you learned a little bit of something, and we'll be happy to see you back again next week for another Did You Know episode. And if you missed one of our Did You Know episodes, don't forget, they're always available on our Facebook page. Make sure that you've liked the CCO Facebook page. Check us out on YouTube as well, and we look forward to seeing you then. Happy coding!